Welcome everyone to the Skilled Nursing Facility Consolidated Billing Scenarios webinar. These scenarios were driven by you and what you asked us to see. So what we've done is compiled from previous education on this topic, Skilled Nursing Facility Consolidated Billing, and the pre-submitted information. That's where this was built. I'll tell you the questions that were affected or the questions that I'm trying to answer as we go through. However, if you have a question that comes up, please put it in chat. Leanne will filter and monitor and try to make sure that anything that I haven't answered is given to me. So just keep that in mind. And what we want to do for you is to give you a basic overview, and we'll talk about why we're doing that in just a few moments. Then we're going to talk about the CMS files, and last we're going to cover those scenarios and questions. But I do need you to understand the overview and the CMS files in order to make these answers make sense, also because that's what people wanted. So again, make sure you add something in chat if you need to. Couple of things. There is a disclaimer at the end, and it just is something you can take a chance to read. It's not anything major. It just says, hey, this information was current as of. The second disclaimer just says we're going to use CPT codes. So take a read through those if you want to. They're at the end of the information. So our objective today is to help you determine when to bill a skilled nursing facility versus Medicare. It is the provider who is billing and will be paid for our services responsibility to determine this before you bill Medicare. Now, again, to do that, we do have to give a little bit of an overview because I did have some people ask for the basics, starting back. What is consolidated billing? And I don't want to leave them behind. So we'll have a brief overview. For some of you, it's going to be a review, and others of you, it will be a starting point. We then will talk about the CMS files, and then we will get into whatever you've submitted for questions and scenarios and different things like that. And so hopefully you've downloaded the presentation, because those that were submitted in time, which is usually a couple of weeks before, we will build slides for them. So you do have a series of slides first, and then the other ones were ones that we will just talk through. And those are the ones that were either submitted after the slides needed to be built to get onto the website or in chat. So what's the first thing that we have to provide? Again, that overview. And this is important because a few people did say, I don't know anything. Can you start with what it is? There was about 6 or 8 people that registered that we really questioned whether or not they were new to Medicare or new to this concept. So let's get started with those basic informations. The first thing you want to be aware of is when you talk about SNF Consolidated Billing, this is a form of bundling for the Medicare payment systems. This is the Skilled Nursing Facility Prospective Payment System bundling. What that means is that is the SNF, the Skilled Nursing Facility, in which a patient is inpatient and that skilled nursing facility is receiving a Part A payment, is responsible to pay for most care. The care they are not responsible to pay for is things outside of their scope of practice. Wow, that was a lot just to take in. So in other words, the SNFs get one payment. They're responsible for paying outside providers if the service is deemed within their scope of practice. That's where it gets confusing, because before we even get to that, you notice I said it is a Part A covered inpatient stay. So let's talk about that a little bit. Under Medicare, there are 2 types of stays. There is a Part A stay. This is a medically necessary stay that meets the Medicare coverage criteria. We'll talk more about those coverage criteria, because if they do not meet the coverage criteria, then Medicare will not be paying for the stay. The basic coverage criteria that goes with this is the 3-day qualifying stay, which is not 3 actual calendar days. It's the day of admission, 2 full days, but does not count the day of discharge. Some people like to say 3 midnights census, however you want to refer to that. But remember, it has to be 3 days. It has to have occurred within 30 days of the inpatient admission into the skilled nursing facility, or has to be justified, medically documented why it needed more than 30 days. Those will make the Part A stay. Once the Part A stay qualifying criteria are met, a skilled nursing facility will bill the admission with that first stay, but they typically bill, especially if their patient is in there for a longer period of time, every 30 days and 30 days thereafter for incremental billing until the date of discharge. Now, did you catch that? Because it's going to come in play later. They bill every 30 days when they're in a Part A stay. Now, a Part B stay means Medicare is not covering the inpatient care. The inpatient care does include things like room and board, nursing care. Those are all part of that inpatient coverage criteria. How long does that happen? 100 days is what is called a benefit period. And that means that the first 100 days we will cover, Medicare will pay for the skilled nursing facility, whether it's full pay or partial pay. And partial pay just comes into effect with co-payments. It's not anything major. Once that happens, however, and those 100 days passes, then it moves into a Part B stay. The other way that a Part B stay begins right at the beginning, if you don't meet the 3-day qualifying stay, would be a coverage criteria Part B stay, or they came in but they did not have any days left. The last one, it's not medically necessary. They're in a skilled nursing facility, they're in that type of care, but maybe the skilled nursing facility also is just a regular nursing home where someone could stay. Those would all be situations where it's a Part B stay. So Medicare is not covering the inpatient type care. It does not mean a person cannot have Medicare benefits. That's why it's referred to as a Part B stay. The benefits they are eligible for are benefits that would be otherwise payable under Medicare Part B, not the inpatient care, but the outpatient care portion. So hopefully that makes sense when we talk about Part A and B stay. When we're talking about skilled nursing facility consolidated billing, we are talking about a Part A stay. If it is not a Part A stay, then consolidated billing does not apply, with the exception of one benefit, and we'll talk about that when we get into the categories on the CMS website. I was asked specifically about excluded services, and I've included this slide a lot of times when we do education, but I need you to understand that Medicare has excluded services and SNF consolidated billing excluded services, and they are very different. A Medicare excluded service means this is a never covered service, not under the law. The SNF can't bill it to Medicare, nor can you as a provider. It is a patient responsibility service. There's no way around it. It's not like you can do something with it. It is what it is. Medicare will never pay for it. If you want to think about it from a private insurance perspective, how many of you get your booklet and it says, hey, this is what your covered services are if you have services beyond ... They're not part of our insurance plan. It's the same thing for Medicare. This is different than a skilled nursing facility consolidated billing excluded services or SNF CB excluded service. The reason that this is different, it says that SNF CB means the skilled nursing facility is billed or not billed for the service. If the skilled nursing facility is billed for a service that is medically necessary and is not excluded for coverage, they will bill Medicare, will become part of their prospective payment. If not, then you as an external provider can bill Medicare. So the SNF has to also determine this. You as an external provider need to do this, but so does the SNF, and they do have to look at the excluded services and the coverage that go with that. I was asked if there's a nice resource and easy to read resource, things like that. So there's a couple of different questions. There is not technically like a quick reference resource that would say this is always excluded or this is included. I do, however, really like a part of the Medicare internet only manual, the benefit coverage manual. I think it's got a great summary synopsis, and I think it's a great chapter to start with. So I'll show you that on the CMS website. And I just want to verify with me that you can see the CMS website.
Tom, we can.
Perfect. So I will walk you through step by step on this one, and you will want to take notes. Otherwise, you can wait a little bit if you want and use the links that I provided later. So on this one, you will come to Medicare because that's the program we're talking about. Now remember, CMS does Medicare, Medicaid, state children's health, etc. We're just going to focus on Medicare. Inside there, once you selected Medicare, I want you to scroll down and on the left side, select Regulations and Guidance. On the right side, use the first link in the left-hand column and it's called Manuals. Then use the first link again in the left-hand column and it's called Manuals, or Internet-Only Manuals, sorry. There you can scroll down and you'll see a large number of manuals listed. The one we're looking for is 100-02. This is the Medicare Benefit Policy Manual. Now there's a lot of chapters, so look away if you don't like a quick scroll and I'll tell you when to look back. What we're gonna do is scroll towards the bottom and we're gonna come to chapter 16, so you can look back now. You'll see chapter 16 is our general exclusions from coverage, and it will explain a variety of things that you need to be aware of. Here's services not reasonable and necessary. This gives you the information that says, hey, in order for a SNF to bill us, it's got to be reasonable and necessary. If it's not, here's what that means. That's that excluded from Medicare program, not excluded from consolidated billing, but straight out excluded from Medicare that says the patient responsibility. So I thought this might be a good place to kind of take you to get that little bit of a list. I'll jump back to the PowerPoint. Again, feel free to use that as much as you would like. This excluded from consolidated billing services are in a separate section, and I will cover those in just a few moments. So when Medicare reimburses, it includes payments for Part A services and Part B services. So the reimbursement is done differently, and this is why consolidated billing can be confusing. Part A services are billed on an inpatient UB04. Part B services can be billed on an outpatient UB04 or CMS 1500. Now keep in mind, there's also the electronic equivalent claims, which is how we receive about 95% of our claims. The reason that we typically talk on the paper claim form is what people are most familiar with. If I were to tell you that's an 837I loop, segment, people will shut me off. So we do talk a lot of times about the paper claim form just because it's easier to visualize. Okay, so a couple of things to keep in mind. When we look at the skilled nursing facility, they will always bill the facility charges on a UB04 and they will always have a Part A service charge. That's what makes the bundling a portion of it. It does not mean that Part B services are not included as long as they remain in that medically necessary care. Okay. When we look at the Part A services, they are billed at a 30-day increment, starting with the day of admission, then we'll follow that up 30 days. Then that gets billed, so it could be 45 days or 60 days, but the SNF also has to bill in chronological orders. So 30 days has to bill and pay or bill and process before the next 30 days, before the next 30 days. If at any point something breaks down, that may not go through the entire system. Why does that affect the Part B services coming from those external providers? Now, external providers are commonly billing either on a UB04, but with an outpatient claim type, or on a CMS 1500, either one of the electronic equivalents. Again, these are Part B services. You have no set time frame. You don't bill every 30 days. You could do a service in the morning and bill it in the afternoon. Perfectly fine. What happens when that that inpatient Part A service claim comes into our system and says, hey, guess what? We've now passed, oh, wait, it's 70 days later, which is fine. It's well within their timely filing limits, but we already have all these Part B claims that have paid. That's where some of those issues come in. That's where some of those manual refunds come out. Or I should say automated refunds, not the manual ones. The manual ones will be indicated and they will look more at those, they being the staff that does that. There's a whole team here at WPS that does that. But the system also has automated that just takes the money back, and we have no idea other than once it's taken back, a letter goes out and you come back and say, hold up, why are you taking my money back, right? That's an automated response from the common working file to our payment system and to our recovery system, HighGlass, the health insurance. I forgot what it stands for, but it's called HighGlass. Okay. So please understand that reimbursement, once the Part A claim, once the main claim comes in, it can look at things differently. which then says, okay, you got this bill. Now what do I do? Do I bill the SNF? You may have to. Do you do an overpayment appeal to Medicare? Well, you may have to do that too. So we have to determine first what's going on. Okay, is it part of the SNF's responsibility? Is it Medicare's responsibility? If it's the SNF's responsibility, please remember that billing them can cause that ripple effect that we talked about, because remember, their first 30 processes before their second 30, before their third, before their fourth, then the second can go, but that has to process before the third and the fourth, all the way down the line. Okay, so when you send late charges to them or charges they didn't know, adding those charges can actually mess with their claims processing, in that it takes time for us to then get the charges, do an adjustment, do whatever we're going to do. So that's why they ask you to try to determine it up front, and that is both the SNF and Medicare. So hopefully that makes sense with Part A and how the billing systems work and why it's important. Because I was asked quite a bit of questions on those, and I think it was just some of those people that really needed that basic stuff. All right, that brings me to the end of the basics. The next section that I'm really going to delve into is the CMS files and where they're at on the CMS website. Now, again, as I said on your file deck or on your slide deck, there is some links and you can automatically take them there. Those are completely up to you. You should, at this point, have put any questions that you have just on the basics back into the chat. So let's just make a quick check. Leanne, do we have any questions that need to be covered for clarification before I go on?
Tom, we do not currently have any questions in the chat.
Perfect. All right, so the next section is the key to consolidated billing, is the key to the SNF prospective payment system bundling. And it's the key because it's which services are considered part of the skilled nursing facilities care, which are considered not part of the care. So that's why it's key. Before I get too far into it, what I want to do is move to the CMS website and show this to you. What this is actually going to be on your next slide. You'll see the location, the list, the steps to get there, but I want to show this to you live. I think it'll make it a little bit easier, a little bit more for what you're looking for. And this is what the website should look like. So let's take a quick gander. We're going to leave the Medicare policy benefit policy manual, which we were there, and we're going to go to Medicare again. Now, under Medicare, what are we talking about? Skilled nursing facility consolidated billing. Notice the emphasis on billing. So which section would you go to? On the left navigation, and if you go down, you'll come to coding and billing. Well, that makes perfect sense. Then you're going to move to the right side, and you're going to move all the way to the right column, and you're going to go to the skilled nursing facility consolidated billing page. Cool. Now on this page, you have information that explains consolidated billing, including the federal law that put this in place. I always recommend, if you're not familiar with it, please take the time. I'm going to continue moving through a variety of slides, and this will go through slide 14 on your slide deck. So you might want to just kind of move through the slides with me. We'll talk a little bit more as we go. All right, so we've located the information on the website. We know that the general explanation is here. On the left column, you'll see a couple of sets of information. The Part B MAC update, I have to scroll down a little bit, and then you'll see the Part A MAC update. What does that mean? There are some services that will never be part of the skilled nursing facility consolidated billing because they're not facility services. Well, what would that classify as? How about the doctor's visits? That's not ever going to be part of consolidated billing. How about services such as the reading of a diagnostic test? Again, it's a professional service, okay? Now keep in mind, there are some services that always will be, such as rehabilitation, PT, OT, and SLP, physical therapy, occupational therapy, and speech language pathology, always. Why? Well, it's a professional service, but that's what they're at this facility for. So those are always billed to the facility. And so we'll talk about that because each file then relates to it. I like to start with the 2025 files down here, and I like to start with the Part A files because remember, that's what we're talking about. Part A, stay, medically necessary. versus the Part B files, which are separate files. Okay, so if we select that, first thing I want to make you aware of, CMS does tell you the Part A, the inpatient stay files, are broken into major categories. If there's an update that needs to occur, they will list the date of the update, what was missed or what was not missed, what needed to be added or deleted, and they'll tell you which major category this applies to. Okay, so always take a quick look at this because we want to make sure we're getting all the correct information. That should answer your question about where the most current information is. So you can see I just scrolled down. If you don't like the scroll, I apologize. On the bottom is where you're going to find the general explanation and the actual files. Before I show you that, I want to remind you that these files are updated annually, which is why there's different information in the middle here. So the next file coming out would be what? 2026 Part A MAC update. That file then directly goes to the system maintainer and they put the edits in place for both the multi-carrier system and the physical intermediary standard system. That's what they're doing here with these edits. But okay, so let's go back down on the bottom. One of the nice things I like to tell people to do, if you're not familiar with this, just start off with this PDF. Take a quick look at the Part A file PDF first. The reason that I like the PDF and the reason that I like for you guys to read it is it goes through each major category and then gives you caveats. What do you have to know about that major category? So for instance, if you're talking about a major category 1 service, these are things the SNF cannot do, but the caveat is they also have a place of service as an outpatient basis at a hospital. This does include a critical access hospital. Okay, wait, what? So what if they had we'll use MRI, which is major category 1C. What if they had an MRI, but they had it at a freestanding facility? Oh wait, that freestanding diagnostic facility is included, where if they had it at a hospital or a critical access hospital, it's excluded. So that's what we're looking for there. So that's kind of what we want to make sure we're getting all the information in. We want to make sure that we are reading all those different categories. But keep in mind, you can even come down and read some of these different ones that talk about this. One of my favorites is F. So most of these are exclusion lists, with the exception of F, which is an inclusion list, because you know what? Skilled nursing facilities can't do that many outpatient surgeries safely. That's why F is an inclusion list. This is a list of surgeries they can do or surgical style procedures they can do. We were asked about emergency room services, and the provider is having issues because the emergency room services are bundling back to the skilled nursing facility. I will tell you that what is happening from what we can tell on that claim is that the emergency room itself is not billing the emergency room revenue code. That is what triggers us to be different. It is not the emergency evaluation and management services codes. It's actually on the inpatient claim. I'm sorry, on the outpatient claim for the emergency room, and they need to be billing revenue code 45X. Without that, on the same line item data service, we will include it. So a little bit more on that. And then again, there's ambulance codes. We're going to talk a lot about this one, but I want to remind everyone they are here and there's some interesting information, including which one should and should not be billed. Because the SNF may have a responsibility for some ambulance services, and this will tell you more about that. You will always start with the Part A file, which is what we're in, and then we'll move to the Part B file. Okay. Somebody did ask if an inpatient claim, the SNF is responsible for an ambulance, why is the 540 rev code being denied? And the answer is it's an inpatient claim. And if that would be associated with something that should be billed to the skilled nursing facility consolidated billing, that ambulance run is actually part of whatever that external or other service is. How did you get there? How did you do the service? It has to happen. The run has to happen. We're not arguing that. What we are saying is, in order for that service to happen, did you have to get the patient there? If you did, that run, that ambulance transport is part of that service versus an independent and separately billable service. So hopefully that answers just a couple of questions. And again, we'll focus a bit more on that. Here's some additional surgery exclusions, and then you get into major category 2, and you can go through each one of these. We're going to look more at this. I will tell you, I would like to jump back and I will open up the actual Excel file. Now, I've done this in advance because this is I'm sorry, this is a zip file. My computer's a bit slow with it. So here's the first thing that's going to happen. We're going to open that file. It's going to say, hey, where do you want to put it? And then go ahead and select it. That gives us 2 files. They are actually the same file. It's just how do you want to read it? With that, I always use the top one. Just me. You can use the bottom one. You can use the CSV. Still going to be Excel. I just like the worksheet better, the XLS. So what happens with that is that it opens up and it looks very similar to this. Again, you can see it's automatically going to give us the major category. This is where I said you sometimes have to go back and read. I don't know what major category 1A is, or 2, or 3, or 27, whatever I'm looking for there, right? I don't know what that means. So it'll tell you here's an inclusion. This is those surgeries that the SNF can do. Again, remember, less they can do than they can't do, which is why it is this way. Then you get down and let's just move on to one of the big ones that was asked about. I'm going to do it this way instead. So instead of me scrolling through trying to find it, if I put Control and F or edit and find, either way, it's just a way of trying to find data really fast. Let's do ambulance and see what we get. All right, so we know this is, okay, major category. And it says, okay, well, interesting, right? Here's where it says I can't build these codes, except it says it's got certain pieces of information. Well, what did that mean? Well, that means that if you come back to the PDF file and you go there, it will tell you that, no, ambulance trips associated with these categories are excluded. In addition, trips associated with this are excluded. Everything else is included. Wow, that's a lot of information. So it's not just about the ambulance trip. It's not just about these codes, which are included sometimes and excluded sometimes. And that's what we learned from just reading that one paragraph. So really what we have to do is determine the service at the end result and then look that up. Now, the end result is where the transport occurred to. So, but again, you can go through any of the major category services. I'm going to give you a little bit more on that, but let me just give you another example. This is one that I like to use. Oops. And it's going to be a, ooh, nope, not that. It's going to be a procedure code. There we go. By using this procedure code, it just helps us understand, hey, it's a major category 1A. It's got some, it is a CT head scan with dye. They're doing a head scan of the brain, but this one was without dye. This is with dye, okay? Couple of things to keep in mind with that. It is a 1A category. So in order to exclude it, it has to be done in a hospital or critical access hospital. If it is done in an hospital or critical access hospital and they're taken by ambulance, then the ambulance run is excluded as well. If not, the ambulance run is included, and that would be done like if it was in a diagnostic center or a mobile MRI, a mobile CT scan, whatever that situation is. So that's how it all kind of plays together. I'm going to use this code again in just a little while when I look at the Part B files, because I do want to show you another interesting piece of information that plays into this. All right, so that's the Part A files. Again, I've kind of shown you how to read them and play around with them. You do need a procedure code. The procedure code is typically a HCPCS or a CPT code, and you got to find it, then go through and find what major category and translate back to this file, which will then help you understand. Okay, along with that file, there's a Part B file. Now, these are for services that are not ever considered Part A. That makes sense. Or services that would typically not be, but again, are. Here again, we do start off when we come into the file list with the additions, changes, deletions, things that you might want to be aware of. Again, updated annually, so 2025 is the most current one. We're just going to scroll to the bottom here. Again, I'll tell you which file it needs to be added to, etc. When we get to the bottom, you'll actually see 4 different files. In order to explain these files, I like to just open the file. So let me just open up file 1. And this is what file 1 looks like. A little bit different, right? You'll see no major categories, but it's just a list of services, whichever service you want. But what we're really looking for is up here. These are professional services. A professional service, other than interpretation of a diagnostic, which will be in file 2, are always billable to Medicare. They're not even part of the covered Part A stay. You'll just bill this. So if you have something that you think is a professional service, you might want to just check it out. So 70450, remember it was a CT, which would be other than the interpretation of a diagnostic test, because this would be considered a diagnostic test. What that means is that if I tried to put this in, it will not find it because it's not on this list. It's on file 2, and we'll talk more about that. But this could be almost any other type of service that's a professional service. So what if you happen to do it and you said, hey, I want to do an office visit. Now this is just an established office 99213, and it's saying, hold up, this is not part of consolidated billing. You should bill this to Medicare with place of service appropriate, and we'll talk more about that in our scenarios because you guys did ask about that. So what do we have to know? If it's a Part B stay, it's place of service appropriate 11. And we'll talk again more about that in just a little while. All right, so that's just one way to use this file. The other types of files, one, we would have a Part 2 file. We talked a little bit about this. Now this is the technical and professional component file. So we saw on the Part A list that you have to sometimes bill Medicare and sometimes bill the facility for certain services. This is the list that in file 2, it will tell you which ones have a or not. Okay, there we go. I'm sorry. Have a professional and a technical component. On here, it literally tells you if it has a professional component, this must be submitted with modifier 26 to Medicare. The technical component is then submitted to the SNF. Whether the skilled nursing facility wants you to use a modifier TC is up to them. However, they are not responsible for paying the professional component. When they look at a physician fee schedule, they should look for the professional and technical and not the global charges. Okay, now that's up to them. But I also want to remind you that we're not involved in that payment process. That's between you and the skilled nursing facility. Where we would be involved is for the professional component because that is the Medicare payment. Okay, so you have a 26 and a TC and you need to bill this correctly. If you bill either Medicare or the skilled nursing facility without the modifiers, both of us can deny, stating it is not ours to pay. That's one of the primary things you need to be aware of. Again, so you can go through and you can search for any of those. Here, I'm just going to put in that one that we already mentioned, and I've used it a couple of different times, but let's just throw that in here as an example. Here's the CT scan, and here's where it says CT scan, modifier 26, bill Medicare. CT scan, modifier TC, bill the SNF. So hopefully that answers your questions there. I had quite a few people that were a little confused on that, but it is it is file 2 under the Part B files. Okay. File 3 is ambulance transports. So remember what we said earlier was that in order for, and I'm just gonna, well, there we go. It says, in order for us to build these codes separately, we have to start with the end result. If the end result is done and it is on the exclusion list, major category 1, major category 2A, then you would want to bill these codes to Medicare. These are individually payable by Medicare. However, if it's not on that, then you would want to follow the bundling process, which says the ambulance transport is part of a procedure that needed to be done, because how did you do the procedure without getting them there? I know that that's a bit of just a high level overview on that, but we do offer a course specifically on ambulance transport because it can be a little confusing when you're really trying to look that up. And the last file is one that I find interesting because this is a outpatient physical, occupational, and speech therapy file. Now, the skilled nursing facility is always responsible for these codes. It doesn't matter if it's a Part A or B state, they are responsible. that's what the patient's there for. Therefore, any code that falls within this must be billed to them. These are always and sometimes therapy codes as defined by CMS. So, all right. That brings us to the end of the file explanation. Again, if I'm going to jump back, I just did go through this slide. I did go through this. We talked a lot about it. Again, so just a major category, some information you need to be paid. Part B files, information on those. So that brings us to some scenarios. Now, these are things that you asked us about, and they may or may not be directly related to a file. They may just be a general question. So I will kind of go through these different scenarios, and I will reference back to the certain files that go with them. So the first one actually is the emergency department codes. And why doesn't procedure code 99281 automatically make it exempt? Well, I explained this when we looked at the major category files. Remember in the explanation on the major category, it talked about it has to be billed with a certain revenue code. So I do understand that a 99281 may not be exempt. Here's the catch. Is the 99281 on this file, which is the part, the file 1? And the answer is, okay, it is. So the actual emergency service is. Here's what happens, and this is where the question came from. What happens to the other services associated to this? They may not be, because they still have to follow the rules and guidelines of the emergency service. So that means that if it's not billed correctly, if it's not done by the facility correctly, something like an x-ray or something taken could have to be split billed. There's a variety of different factors that go into that. Okay. So hopefully all of that does make sense when we talk about that. I was just specifically asked about this code. I don't know if you are having issues with this. It should not be giving you an issue. Again, it is specifically listed as an outpatient service and should be billable to Medicare on a correct claim form with that information. We say correct claim form because if you're a method 2 payer for CA, or if you're an RHC or an FQHC, you would bill this accordingly, which is a UB04 or 837I. Otherwise, you would bill on a 1500 or 837P. Okay. So hopefully that gives us the answer we need for that. Again, if it doesn't, I would need you to put a little bit more information into that one for me. And I do want to remind you about major category 1G, which does list it based on that revenue code. So that was our information. This would be separately payable, but anything else done may not be separately payable, and you'd have to go back to major category 1G to determine that. Initial preventive physical exam, I was asked 2 or 3 questions on this. I'm going to lump this into just in general preventive physical exams, or in general preventive services. And in general, once they're inpatient in a skilled nursing facility, the skilled nursing facility can bill this Part B service separately for a separate payment. However, in terms of the fact that they must bill it, it is subject to consolidated billing. In other words, you do have to bill the SNF. The SNF has to pay you if you do this type of service. Keep in mind, it does have to meet the criteria set forth by Medicare. So it could have a frequency criteria. None of that changes. It just doesn't go away. If you're looking for this one, I do recommend that you look at major category 4 and J, which would be what you're looking for here. So again, you're going to come back to the Excel spreadsheet and you're going to look for the major category that falls within it, G0402. G0402. Oh, sorry, it highlighted that one row. That's not what I needed it to. Oh, okay, I know what's happening. So this one is not listed by procedure code. Why is it not listed by procedure code? Because this is an initial preventive physical exam, and this is where the question came in. What you have to do on this one is come back to the Part A files. So we're going to get back on that website, on the CMS website. We're going to open that explanation. Scrolling back down, and we're going to open that general explanation. Here, what we're looking for is the major category. To major category 3, there it is. Major category 4, which is preventive and screening exams. And here it just simply says J, initial preventive physical exam is not. So that's why it's not on the major category, because it actually says right here that it's not part of. skilled nursing facility consolidated billing. But it is part of consolidated billing, but it is a separately payable service only to the skilled nursing facility. So hopefully all of that makes sense. So while you will not find the procedure code on the Excel file, you will look within this document and you will see it as something that is covered here. Drainage, again, this is on the professional services file. I'm not really sure what you're having an issue with this, but yes, you would bill this directly to Medicare. It is a procedure code that is on the professional service file, which means it's on file 1, part B, bill it to Medicare. Please make sure it meets medical necessity and the documentation does support it. That is still something we're going to look at. The next question I was asked on is bilateral breast, can't say that word, sorry, but it is 77063. What are we looking for with this code? This is a split bill code. Oh wait, what's that split bill code mean? Well, the split bill code means that you bill under major category 4A, the mammography service, but under major category 2 or under file 2, you bill the professional component. So again, we have to look at it, modifier 26 to Medicare, modifier TC to the SNF, appropriately billing it, appropriately breaking the fee down, and then go from there. One of the questions that we continue to get is, do the skilled nursing facilities bill or accept a 1500 claim form? We don't know that. We are unable to answer that. Some skilled nursing facilities will even accept an invoice. They don't necessarily require one of the 2 billing forms. This is up to them to decide because they need certain pieces of information in order to get this onto their system. So I cannot tell you whether they need a 1500, whether they need a UB04, whether they need electronic submission, whether they need an invoice without any of that. That is their decision, and you must ask that skilled nursing facility to provide that information to you. All right. So when you go to bill the SNF, you need to ask them, how do you want this in? We were asked about place of service codes. This is actually one of the most common questions. And I think it's because it becomes confusing. When do I bill 11 for outpatient office? When do I bill 31 for an inpatient stay, which would be a nursing facility code, 32 for an outpatient stay in a nursing facility, or 11? Well, keep in mind it is driven based on the type of stay they're in. If the patient is in a inpatient stay, then you would bill an evaluation and management service with a place of service 31. It doesn't matter if it occurs in the office. I gave you guys a reference that will help you with that. And that reference is the Claims Processing Manual, Chapter 26. Now, on 11 or 32 is, where did the service get performed? Well, why does that matter? Well, if it's performed in the office and it's a Part B stay, then you would bill it on 11. If it's performed in the skilled nursing facility and it's a nursing visit and they're in a Part B stay, then it would be billed with a 32. Let me take a minute here and just see what Leanne has to offer, if anything, on that. Okay, well, I can't hear Leanne, so I'm going to assume she doesn't have anything to offer. She's good with that one. As a reminder, the next slide I put in, just if you're using place of service 31, yes, you must bill an evaluation and management code, and that is a nursing code. Here's the chapter reference for that. Even if you're seeing them in an office setting, you still need to bill the appropriate place of service code. Okay. I did go through this. Oops, sorry. Go down again. I did go through ambulance a bit more. I don't know what questions people really have on ambulance, but remember, it's really based in whether or not the service meets the criteria for the exclusion or not from the consolidated billing exclusions. Okay, and there's, again, a whole class on it. Okay. Skin substitutes. These are the procedure codes for it. So you asked me about skin substitutes. I went out and just kind of dug out the procedure codes. You asked me about 15271, but I wanted to incorporate all of it. These are on the professional services file, bill Medicare. That's what we're looking for there. Okay. Dialysis. This one gets a little bit messier. Most of the dialysis, we have a dialysis on site if someone is under a Medicare Part A stay and they want to go to an off site for their dialysis. Is the SNF still responsible? I'm going to tell you first, please refer to major category 2A and bill directly to Medicare, because major category 2A says if it's off site, it was not your responsibility, including the ambulance run for that one. Okay, that's one of those exceptions. So I wanted to make sure everyone was aware of that. I was asked on a 3-day qualifying stay if Medicare defines a hospital, how Medicare defines a hospital, what falls into that category. And Medicare doesn't define it as just a hospital, an acute care hospital or a critical access hospital. They say any type of hospital, so an inpatient psychiatric facility, anything like that that falls under the general category of hospital would meet this definition. They're not saying it has to be named quote unquote hospital. So hopefully that makes sense. Let's get started. What we'll do is quickly go through the pre-submitted questions, and there's a few of those, and then we'll jump into the chat questions. So again, if you have a chat question, please make sure that you're adding it. I do want to make sure that Leanne was okay with my EN evaluation and management answer before I get started with any of that. So Leanne, anything to offer? All right, well, it appears as though Leanne's headset's not working. She might put something in chat down there to help out. Let's see what we got. So first, I had 2 questions very similarly, and I'm going to lump them together. The first 2 questions are, where do we go to verify the SNF Consolidated Billing pricing versus reimbursement for claims? And how do we get to know what the reimbursement should be for consolidated billing? And then last, how to price consolidated billing charges. Let me just state this. None of this information tells us about pricing. Pricing is between you and Medicare, or the SNF and you. So if you're billing Medicare, then you're bound by our pricing guidelines, which gives you an allowed amount. If you're not billing Medicare, you are not bound by them. This is why CMS would encourage you to put a contract in place. And if there is no contract, you do have the right to bill them whatever you want, and they should pay you at that level. Now, if you accept a lower level, that's on you to decide. If there's a discrepancy or you're not agreeing with what you're giving, this is a debt that is owed to you, and you should follow the same practice for any other debt that's owed to you. That's the advice we have on that. So no, we don't know directly because we're not involved in that, especially at the Medicare administrative contractor level. We're not involved. How to bill for a Part A stay, skilled nursing facility for a doctor's visit. Well, the first question I have for you is, when you say a doctor's visit, one, is it a professional charge that would be on that file, one? And if it's not, then what are you billing them for? And is it something that should be billed to them? Or is it something that should be split billed? And we've been through all of those different files. So just depends on how you want to answer it. Okay. Now, if you say, yes, it is that, but no, it's an emergency room visit, that's a professional service visit or a doctor's visit, that's where we come into some of those different caveats. So go back to the information I gave you throughout this webinar. There's a denial bulletin that CMS is preventing certain edits from happening. We're aware of it. We have not seen a fix come through. If that fix does not come through, we can't do anything with it. We're waiting on, just like you guys are. So I'm not sure exactly what you are looking for with that. I don't know a whole lot. I don't have a question. I don't have anything other than that there is this denial bulletin. Yeah, we're aware of it. How do you get SNFs to pay for oncology drugs? So again, we go back to that basic rule. This is something that is between you and the skilled nursing facility, and is this something that is on one of the major lists, whether it's a file list or whether it's a major category, and what is the oncology drug, because there are certain oncology drugs that are excluded based in the major categories. So I don't have a good answer for you. Also, we cannot force the SNF, should they be paying to pay you. That is something, again, that you're going to follow whatever your legal process is for collecting an unpaid debt. All right. I know that Leanna is having some technical issues, so you guys are gonna have to give me a second here. First question we got is how about the TC components? Oh, the technical components. I think I explained this pretty well. So Ira, if you have more questions on it, can you take some time, put it back in? I went through a lot and it looks like this came in even before I went through that. So hopefully I got what you needed. Becky, how do we build a SNF? Again, I talked about that. It's not something we can do. So we want to make sure that you are um, making sure that you get the SNF built correctly. If they should, they're going to tell you what they need. Your next question related to a procedure code, and I'm going to do this way, even though I know the answer. I want to look it up for you this way. So you asked me about procedure code G0402. When you go out, I wanted you to get a definition. Again, preventive physical exam. What did we learn about this preventive physical exam? Well, the G0402 is not on the list directly. It does mean that you have to follow the initial preventive physical exam right here in J, which would exclude it. So hopefully that gives you what you need on the G0402. All right, that brings us to the end of our questions. So if y'all have a question, now's the time to get it in chat so I can get that answered. Otherwise, I think I hit everything up, going through everything. All right, I'm going to talk a little bit more. We'll come back to those in just a second. I always recommend that everyone takes our survey. Again, please take a few minutes. Tell me what you liked about this webinar, what you think WPS does well, how we could do better. Any of that information is really helpful. You can take the survey immediately after this event. That's going to give you an external pop-up box. It's going to look like this. It's not spam or malware or anything else. It's us asking you to go to the survey link. It is the exact same survey link that Leanne just put into the chat. So please take the opportunity to do that. We're also going to give it to you in a follow-up email, and we'll talk more about that in just a few moments. Last, if you want to take the survey on the Encore, once you get to kind of reread this, you are welcome to do that, and that's going to be done in the online survey picture, like the bottom picture here. There's going to be some more information on, oh, sorry, I forgot this one. Medicare is doing our annual participation announcements. For those of you that are not familiar with this, it's part of the physician fee schedule. You do have up until the middle, I'm sorry, December 31st to change your participation agreement should you choose to, which can mean becoming participating or losing that. That's what this information is. If you download the slide deck or if you want to take a look at it, I do recommend doing that. Which brings me to the end. There's a couple of things down in the chat bottom. If you want to grab those notes features, that's great. But otherwise, it's just here for you, and FYI for you. One of the things that's important is that you have 7 days to send me any questions that you have in the next 7 days. If you put SNF CB or SNF Consolidated Billing or Skilled Nursing Facility Consolidated Billing in the subject line, I'll answer those questions back via email. At this point, I, again, don't see anything in chat. I don't have anything, so I don't have anything to answer. We will be listing this on our Encore page, and there was a question that came in about the Encore page. So let me just quickly show you that. It's on the WPS Government Health Services website right here. It's in the training center. So again, right up on the top, and the middle link says training center. By going there, you can go to Encore presentations. The question in particular was, can you get a presentation from this page? And the answer is yes, you can. However, it's a limited time presentation. We keep these out there for 60 to 90 days. And once that has passed, they can go away. How you'll actually need to do that is find the presentation, whatever it happens to be. I'm just going to scroll down into October. I'm looking for is if we had a consolidated billing event in October, where would it be? Here it is. Nope. Well, this is a good one. It is in September, but it's skilled nursing facility documentation requirements. You open it up, it'll let you watch the video. Here's the download the follow-up material. This is where the PowerPoint's at. Okay, so hopefully everything with that kind of helps you through that. If not, let me know and I'll walk you back through that. Oops, sorry, that was not what I wanted to bring up. I want this. All right. So with that said, that's everything I have for you today. We did make it through all the questions. We have everything done there. Please take time to take that survey. Give us the feedback that you need to give us. You have 7 days to send us any additional questions. We'll create an email and we'll just respond to you. If you want to look more about consolidated billing, this is a hot topic and it is one of our top denials. Therefore, we do plan to do more events on this. Again, I don't know what's scheduled or when they will be scheduled, but look into 2026, etc. We will have more. On behalf of myself and Leanne, thanks for attending. We hope they got some great information and please consider taking our survey. You may now disconnect.